Good morning, guys. David Sapker with Walk with a Doc. This morning, I wanted the honor and pleasure of introducing Dr. Siatta Dunbar. She is a sports medicine physician in Burnsville, Minnesota. Her talk is on vitamin D. It's incredible. I cheated, I watched it. I'm really excited. Dr. Dunbar, here you go.
Hello, everybody. Hopefully we've got some folks that will join. Super excited. My name is Dr. Dunbar. I'm a family medicine physician, but I also do orthopedic care, so acute kind of musculoskeletal orthopedic injuries within my health system in Minnesota. But my true passion is sort of lifestyle medicine and health coaching. So my goal is really to help patients achieve health through nutrition, controlling their weight, getting restorative sleep and stress management. I've been involved with Walk with a Doc for over a year, walking with my patients the first Saturday of every month. And really because the organization as a whole really matches my passion, their mission to connect communities through movement and conversation really fits with what I value as a physician and really value as our role in healthcare. So I've always been excited to sort of work with them and host walks. And now, given the current climate, it's challenging for us to meet personally, but I'm super excited to do this virtually. This is new for me, so looking forward to kind of walking and talking a little bit. So given that we have a rare glimpse of some sunshine in Minnesota, it's a little bit chilly, but we still have some sun. Wanted to talk about our sunshine vitamin, so vitamin D. So what is vitamin D? It's one of our fat-soluble vitamins. Vitamin A, vitamin E, and vitamin K are also fat-soluble, which basically means that you have to take them with food. And there are a couple different ways you can get vitamin D. One is food. Happy to see some folks on, local folks, so thanks for joining. So you can get it from your food. There are very few ways to actually get really good vitamin D. Salmon is one, and that gets you about 640, what we call international units of vitamin D. Another one is through trout. Trout will give you about 500 to 600 international units of vitamin D. The rest of our foods are really fortified with vitamin D. So the milk that we drink, 2% milk is fortified. So they're really not going to be sufficient to get you to what's recommended. And really from 1 to 70, we typically recommend about 600 international units of vitamin D a day. So we call that the RDA, or the recommended dietary allowance. And what that says is that's the number that we feel is sufficient for people to take in, for a healthy person to take in. So if you have some unique health issues, you may need more. So some of this means that you need to sort of check with your doc and make sure that your health, your current health, doesn't require additional units of vitamin D. And then the other way you can get it, other than your food, is through sunshine. So we do convert some vitamin D in our skin, and that happens, what we recommend, 15 to 30 minutes a day, or a couple days a week, I should say. Midday sun is probably the best to do some conversion of vitamin D, but that also depends on your skin tone, right? So darker skin is not going to convert as well, or you're going to need longer amounts of time in the sun. But that's one other way. So hopefully that reconnected okay. So supplements is another way to get adequate amounts of vitamin D. And again, depending on what your current health needs are, you may need more, you may need less, or your doc may say you don't need any at all. So it really just depends on everybody's individual needs as to whether or not they require a little bit more vitamin D in their diet. So why is vitamin D important? So vitamin D is it helps to absorb calcium. So calcium and vitamin D together is what gives us our bone health. So lots of folks may be concerned about osteoporosis, or gosh, should I eat more vitamin D because I'm worried about fractures, those sorts of things. So vitamin D and calcium, again, is what converts or what helps us with bone health. In my world, dealing with orthopedic injuries, if I see somebody who's got a fracture, they're not healing well, that's my first thing as I start thinking about their vitamin D intake. Folks that are having multiple stress fractures, screen them for vitamin D deficiency, those sorts of things. Vitamin D also lowers inflammation. So folks that suffer from arthritis or rheumatoid arthritis, inflammation is a huge component of both of those disease processes. So making sure those people have sufficient enough vitamin D, supplementation if necessary. And then also it increases your immune function. Again, super important right now. What are we doing to sort of maximize our inherent immune function given the current crisis? So vitamin D really important for that as well. So in lots of ways, it's a super critical vitamin. And then there are other sort of subtle ways that we could be affecting our vitamin D absorption and our levels of vitamin D. One we talked about is skin, right? So if you're darker skin like myself, you have a lot of melanin in your skin, you're going to require more sunshine to be able to convert your vitamin D. So in that case, supplementation, it may be helpful. If you're in an area kind of like myself in Minnesota, where it's kind of overcast for a better part of our year, supplementation may be beneficial. In some cases, I recommend people supplement through our winter months, October through April. Again, depending on their other health issues, right? So we just have to evaluate that with your doc and see what's the right amount of supplementation for you. Also, if you have Crohn's or celiac disease, places where it affects absorption, because your vitamin D is absorbed in something called your small intestines. So if those are not absorbing appropriately because of some other health issues, then you may require some supplementation, again, in conjunction with your primary physician and your regular doc. What else? Those are probably the key ways. Diet, right? Obviously, we talked about diet. So salmon and trout are really good sources of vitamin D. But again, you're getting maybe 400, 500, 600 IUs from those. But again, you need 600 a day, right? So we've got to think about our diet. The healthier we're eating, the better chances we have of increasing our vitamin D. Also fat. So fat loves vitamin D. So if we're overweight, if we're carrying too much adipose or fat tissue, then our ability to convert that vitamin D and what's available to us is much, much less. So really weight is a big, big factor in the availability of your vitamin D to do all the good work that it does, that increasing your immune function, decreasing inflammation, and helping with your mood. Sometimes depression and mood changes are implicated with low vitamin D levels. So all of that plays a really, really big role. So overall, key talking points, vitamin D is important. 3 ways you can get it: food, good old-fashioned sunshine, and supplements if necessary. We need about 600 international units a day, and that's for a healthy person. Again, assuming you don't have other health issues that would say that you need more. So all of this really should be done in conjunction with your primary doc. You can convert it with sunshine, but darker skinned folks may have to stay in the sun a little bit longer. But again, you've got to weigh that against risk of, skin cancers and those sorts of things. We still recommend sunscreen. So again, that may be a case where there's some supplementation necessary. And then again, really eating a whole food, plant-based diet to maintain a healthy weight, getting regular motion, healthy motion to maintain a healthy weight, because that again affects vitamin D and what's available to you. If we're carrying too much weight, you're going to have less available. So those are my key points for vitamin D. I wish I could walk with you the whole time, but I'm going to lose signal. As you've noticed, I've probably been walking up and down the same spot because it's the only way I can keep the signal going. So thanks for watching. I'm going to keep walking. I'll probably go corral my kiddos, get them outside and let them walk a little bit with me. But stay healthy. Still reach out to each other. We're all essential. There's a lot of stuff going around about, only essential people are going to work. We are all essential through all of this. So we all have a role to play. Reach out to your family, your friends, your neighbors, your community. Make sure people are doing okay. Make sure they're healthy. do porch drop-offs, let kiddos play outside, to sort of include some elderly folks that maybe not, maybe can't get outside. So we all are essential, and it's going to take all of us to get through this. So thanks for listening. Thanks for walking with me, and enjoy the sunshine, at least in Minnesota or wherever you happen to be. Take care. Bye-bye. Stay healthy.